Do you suffer with pain? Are you looking for relief? There is help. Welcome to Back Talk with Dr. Steve Lininger, brought to you by Manassas Chiropractic and Rehab. And now, your host.
Thanks so much for joining me this week for Back Talk with Dr. Steve Lininger. My name is Kimberly Henrie. I'm your host. And today we'll be talking about chiropractic care for children. Now, before Dr. Steve Lininger joins us, just a reminder that if you have questions at any time, please visit us at www.chiropractor-manassas.com. Dr. Lininger, it's great to talk with you as always.
It's great to be back. Thanks for having me.
We're going to talk a little bit about different ages and stages of chiropractic care today, or specifically on one particular group. But how old is too old for chiropractic? We'll start there.
If you have a spine and you're breathing, then it's a good thing to see a chiropractor. I always tell people that if they have a spine and they're breathing, it's a good thing to get checked by a chiropractor.
So that kind of answers the second question, and that is, how early should you start, or is there an age that's too young to start seeing a chiropractor?
No, there is not. I've treated patients as old as over 100 years old, and I've adjusted patients as young as a couple weeks after delivery.
So is it safe in all of those age ranges?
Yeah, you have to change up kind of what you do a little bit. If I'm adjusting an infant, I'm not going to adjust them, say, the same way I would adjust you. I would use the tips of my fingers, my index finger and my middle finger, to very gently palpate just kind of work my way down from the skull, just very lightly nudging the vertebrae to make sure that they're motioning correctly as I check the baby's neck. And if I deliver an adjustment, it would be using one tip of one of those fingers in a very, very gentle motion.
Wow, so it sort of reminds me of... Yeah, it reminds me of like CPR certification, with an adult, you're using both hands and you're really pounding down.
Yes, that's a very good analogy for the general public. That's right. It's not going to be the same. And all chiropractors have been trained to take care of very, very young people, as young as infants, and as well as there are certain precautions you have to take with an older person. You, of course, with an older person, when you're dealing with a SEP or an octogenarian or above, somebody that's elderly, you of course want to view films before you would give them an adjustment. Mm-hmm. And that's primarily because chance for osteopenia, osteoporosis, rib fractures, old fractures, things like that are very possible in those age groups.
Sure. And
just like I change it up for the infants, again, you're going to take very gingerly steps with an elderly person, and you're not going to deliver typically a full thrust when you adjust them. Just a little click is typically all they need. Mm-hmm. And again, it's very similar in the way that I check an infant and the way that I check an elderly person. Again, using those tips of my fingers, very, very soft, very gentle, very easy. Our first was a prima nocta, first do no harm.
Right. Is that the Hippocratic Oath? Or?
Right. It is. And it applies to every medical professional. Mm-hmm. We don't want to injure them. So we're not going to adjust if we think that it could possibly cause an injury.
Okay. So bringing the conversation back around to our younger members, children, mm-hmm. infants, we think of, we've talked in the past about chiropractic care for, like if you're sedentary and you're sitting and you're, compression on the spine and nerve damage and stuff like that. What are cases in which you would see a child or a baby?
Well, I tell all of my patients and my staff that, and anybody that will listen to me, actually, that the second they bring the baby home from the hospital, a lot of people don't understand this, but when your baby's born, they check the reflexes, they do the Babinski, they check the pulse, they check the heart, they check the lungs, they check the skin, they check the hair, they do all these tests, but they don't check the spine. They don't even consider that. And that's what holds the central nervous system of the body and delivers the impulses from the brain to the entire body. So, and they don't even check that. when the baby's born. They don't even consider it. So I always tell them that every baby should have his spine checked along with those other tests that they've already done in the hospital.
And what are you looking for when you're checking that, the spine?
Okay, so the birth event itself is very traumatic to a human spine. The average baby has a neck that's less than an inch long, and during the delivery process, the physician or delivery person, on average, 40 pounds of pressure placed on that 1-inch neck. And that's from a birth without forceps. And that's average. It can be more, it can be less,
Wow.
but it's about 40 pounds
Wow.
on a 1-inch spine. So that can subluxate or misalign vertebrae.
Mm-hmm.
And there's no way for the baby to tell you that that's going on. Typically, a lot of the problems that I see in young adults or into even adulthood were actually caused or originated by birth trauma. So a lot of the loss of cervical spine curve that I see in patients on x-rays when they're 25 years old may have begun during the birth, and they didn't even know. And either because that straightening of that cervical curve, which can be detrimental to the heart and lungs.
Oh.
And they don't even consider it after you're born as far as checking it. No one checks that. So it's very important that I believe that it should be checked. And the way that we check it is, again, palpating down from the skull with our fingers tips, very gently, just touching the baby's neck. Typically, if there's a misalignment and you touch it at a certain point, the baby will wince. He'll let you know. With the same amount of pressure above and below it, if he winces at one area on his neck, there may be a subluxation or a misalignment there.
Oh, wow. Very, very helpful information, especially for, of course, someone who is yet to be a parent, or even parents of very young children. You could still go get that checked out, I'm assuming.
Yes. Oh, absolutely. Yeah. I do it for free in our office for children.
Okay. Good to know, too. Dr. Leninger, what do most parents typically bring their children in for chiropractic treatment for? What are the symptoms?
The most common symptoms I see in a child that is 2 and under that the parents bring the child for is colicky. Colicky in an infant, and then not sleeping through the night as they get a little older are the most 2 common I see. Sometimes bedwetting, but mostly it's colicky baby or not sleeping through the night and or constipation. Those are usually included.
I wouldn't think of go see a chiropractor for those things. How are they related?
Okay. So as far as the constipation, the intestinal tract is controlled by nerves. If those nerves are inflamed and they trace back to the lower back, the nerve may be pinched in the lower back, inflaming the intestinal tract, which can cause constipation or irritable bowel or diarrhea.
Wow. And so that you just adjust that and relieve the pressure on the nerves.
That's right.
Okay.
Now, that's if it's caused by compression of the nerve. There are other things that can cause constipation. But that's one of the most common is subluxation. It pinches the nerve going to the intestinal tract, and then that can be easily corrected by a chiropractor.
Wow. Okay. How would you know that that's the reason?
Well, that's the purpose of the exam and the diagnosis, the history. Sometimes X-rays, sometimes MRIs. Depends on the case. Okay. What you need. And then I personally like to. I don't like to take a whole lot of X-rays with children if I can avoid it, but sometimes I have to. Sure. But usually the exam and history are enough, especially with a baby. I typically don't. I don't personally take X-rays with someone that's under 2 unless they were in an accident. Okay. And so a car accident or some other kind of accident, just like when we talk with adults, we've talked quite a bit about that. Is there a difference in treating children and adults in those situations? Absolutely. The children sometimes have more developing bodies. They have growth plates that have the end plates on their bones haven't joined together yet, and sometimes they can endure more of a fracture or more of a injury to the joint than an adult. The ligaments are more lax than an adult. There's lots of differences in the body that are occurring compared to an adult and a child, so that when they get into an accident, they can experience the same or even greater symptoms than the adult does. So it is necessary for them to get treatment typically after an accident, just like in an adult. The treatment may be a little different for the child, but it is they can experience the same symptoms, and typically they won't tell their parents everything they're experiencing because they don't want to bother mom or dad, but they always tell me when they come in.
What's going on? Sure.
They will.
We've got probably the things you don't want to know too, if they're anything like my kids. And I know that parents are probably sitting on the edge of their seat wondering, how does chiropractic treatment help with colicky babies or children who are not sleeping through the night?
Okay, so a lot of times there's a subluxation in the neck that can be pinching off or choking off a nerve that is going to the cerebellum, which can cause balance, coordination problems, things like that, or headaches. That can cause the baby to cry a lot. More commonly, though, it's in the lower spine, again, with the nerves going to the intestines. That's going to be the pudendal nerves, typically S1 or S2, maybe L5 nerves that can be compressed or irritated, and that can cause the baby to be constipated, which is, he's not going to be happy,
right?
To say the least. He's going to have trouble sleeping, those types of things. He may even be wetting the bed. And that's typically, though, with someone who's older when they're wetting the bed, when they come in. When they bring the parent brings the kid in and he's 8 or 9, he's still wetting the bed.
Okay. So you've really helped us out a lot. There's a lot of different things to watch for and a lot of different things that you can help us with that maybe we can't get solved in any other way, for sure.
It's possible.
Yeah. Okay. And we've just about run out of time, but I do want to make sure that folks know how to get a hold of you. So what's the best phone number and your website?
Phone number is 703-396-7770. Website is chiropractor-manassas.com.
And tell us how to find your office.
We're located next to Klein Freeze Ice Cream at 8214 Centerville Road in Manassas.
All right. Well, that just about does it for us. Can you think of someone who might benefit from what we've covered here today? They'll thank you for forwarding this on to them. And a reminder that if you enjoyed the show, you can also share us with your friends on Facebook at facebook.com/Manassas Web Radio. Dr. Leninger, thank you so much.
Thank you for having me.
Thank you for listening. To join a discussion, visit us on Facebook at facebook.com/Manassas Chiro. And to schedule an appointment with Dr. Steve Leninger, call 703-891-9501. That's 703-891-9501.